And here we are on the couch with Rob Olsen from the New Zealand Rural General Practice Network. Rob, 2015 conference almost over. A very different conference this year because it's been a rural conference.
Yeah.
How's it been different for you?
Well, I think the overall composition of the program, it's had added content in that we've had the Rural Health Alliance, Aotearoa New Zealand involved. So that's offered a community stream and a whole sort of broader rural view of health added into it. So we've had our traditional streams, which have been medical, clinical, rural hospital, management and nursing, and then we had the sixth stream, which has been the community stream. So a completely new dimension to the conference, which has made it truly a national rural health conference. So bigger, broader, and much more interest in terms of the program, I think.
I'm seeing a wider variety of people here, more students, more lay people as well, which is great. The highlights for you?
Well, there are many really, and I think if we were to give an overview of the highlights, certainly starting with things like the venue.
Yep.
Terrific venue, can't speak highly enough of the Energy Event Centre. Don't want this to sound like an advert, but there are venues and there are venues.
Yes, you're right.
I think that the Mihi Whakatau too, which is our official welcome ceremony in Rotorua, was very, very highly charged. Very powerful, and went down extremely well. We had a full house again, so yeah, very pleased with that. It's an important part of the network's conference. Yes. Getting our cultural themes just right. So yeah, very pleased there. Delegate numbers too, I think fantastic. We had probably overall 450 delegates.
Wow.
So that's probably the best number in the 7 years that I've been involved.
That's good. Well done.
Yeah, so we're building there.
That's good.
Yep, looking to up that number.
Yes.
For next year.
Let's go for 500.
Part of that, of course, was the student numbers too.
Yes.
They have grown, and a lot of that is due to the work of our student delegates on the board. So yeah, big thanks to them. Lots of energy there.
Very active. Yeah, you can tell.
Absolutely, and I think the awards ceremony too was extremely well executed this year. We went from having really one award to having probably 5 or 6 awards all rolled into one ceremony, and that included the World War I commemoration this year, which was again great.
Very moving.
Very well received.
Outstanding. Yeah.
I think the program, of course, as I said, the extra community stream in there, lots for people to go and see. We actually had one less stream this year than we did last year. We ended up with 7 streams last year, which proved just a little bit too much of a stretch, so that kind of diluted some of the sessions. But this year we've got the mix just right, I think. I don't know the exact numbers, but I think everybody is speaking quite highly of attendances, etc. Obviously the speakers, we've had huge variety of speakers. The keynotes especially were right up there. We had Lance O'Sullivan from the far north, 2014 New Zealander of the Year, and we had a full house for his first up presentation. He actually opened the session, so I think that was much anticipated and very well received.
He's a damn good speaker too. He's got a great story to tell.
Yeah, he has, and I mean he works from the community, sort of, that's where his heart is at.
Well, that's the theme of the conference as well. I think a lot of the things, he was just he opened on a lot of the notes that were reinforced throughout.
Absolutely, yeah, close to home. He's all about getting out into his community, and not just physically, but also using technology to get out there with his Vimako and those sorts of initiatives, and getting people to take responsibility for their health as well, getting them involved. So yeah, very much the heart and soul of what rural health is all about.
Yes. Yeah.
I think. Also the Minister of Health, but no, again, very well received. I mean, the Minister was pretty straight up and honest about things. We had good feedback from the audience who sort of quizzed him on some pressing issues, and I think overall very well received. Hopefully we can get him back next year.
Great. Yes.
Yeah. Ernesto Sorelli, I think, was another highlight. He came all the way from the US to speak to audiences, and I think in the end we got a pretty well attended sessions for him.
Good. Yeah. Great. I've been impressed with the suppliers.
Yeah, I mean, I think, without our exhibitors, and I guess that's what you mean by suppliers, that's fine. These sorts of events wouldn't happen. They're obviously an integral part of the health sector, so we appreciate their support, and they add a colourful dimension to the conference overall. Dunedin has been confirmed as the venue for 2016, probably around the middle to the end of March again.
Okay. Rob, thank you yet again.
Pleasure.